Hey there, I'm Dr. Eric from Impact. Listen, this video is on dry needling. It's an effective treatment approach that we use here at Impact PT, and all our clinicians that participate in dry needling or administer it are highly skilled and have many years of training, and also go through a certification course so that they know where to stick them, and you have the assurance to know that if somebody's sticking you with a needle, that they've had lots of experience and practice. So now, dry needling, why do they call it dry needling? Well, part of that is because we're not actually injecting anything into your body. So opposed to wet needling with cortisone or lidocaine, some of those things that doctors use to inject into your system. With dry needling, it's just a filiform needle. So there's nothing actually going into your body but a small sterile needle. Now, when I say small, I'm going to show you here in a second, it's really, really, really small. When people think of needles, sometimes they freak out and just have a lot of worry and fear. But I want to assure you that these babies are extremely small. A little long for certain areas, but very thin. So now a lot of questions we get are, what's the difference between dry needling and acupuncture? So acupuncture is more based on traditional Chinese medicine. So they're going after meridians and energy points, maybe symptomatic points as well. They're using it more for a systemic kind of approach. With dry needling, we're really attacking more trigger points, painful areas. We're using it clinically in conjunction with what your symptoms are. So let's say if you have an elbow issue, lateral epicondylgia, which is a common elbow pain that we use dry needling for. Well, we'll put needles in the area of where you have symptoms on your elbow. We also may put needles up in the nerve root, up into the neck area that control the nerves that go down into your elbow. So if we decrease the nerve sensitivity up above and also the trigger points and inflammation down here, then we can kind of get a double whammy. So dry needling, a little bit different than acupuncture, both really effective, but here at Impact, we participate in dry needling. So I'm gonna kind of show you on this video so you can actually see what the needle looks like. So every needle is sterile, only one-time use, so don't worry, you're not gonna get anyone else's germs or needles put inside you. They come in this sterile tube with a little spacer right here, and it'll be hard to see on the video, but I want you to get a sense of what that looks like. So you can see it's extremely small, sterile, and there's a little spring on the end there. So that part goes into your body, and then you puncture it into the tissue. And then of course we dispose of the needle once we're done. So listen, dry needling, we use it for a variety of things. It's not a have to. We can get great results without it, but it is one modality that we do like to sometimes incorporate into our treatment approach. For headaches, it's really good. Neck pain, back pain, elbow pain, knee swelling or ankle swelling, you name it, we can probably put a needle in that area to really make a big difference. Hey, if you have more questions, please message us or reach out. We'd love to hear more about what's going on with you and how dry needling might be able to help.